Hey everybody, it's Dr. Seth Evans. So this is in a continuing series that I'm doing on urgent problems in ear, nose, and throat that I see in my office. So today's topic is going to be on foreign bodies in the nose. So we recently did one of these on foreign bodies in the ear. So in this case, we're talking about things that are stuck in the nose. And I would say this is almost 100% children, or I guess maybe adults with mental problems would do something like this. So with foreign bodies in the nose, it's a little bit different from things that are stuck in the ear. So I'd say there's kind of parts of it that are more serious than things that go in the ear, but there's part of it that are actually make it a little bit easier when things are stuck in the nose instead of in the ears. So the more serious part is that the inside of the nose is part of your airway and your breathing passage. So there's the possibility that if something is stuck inside of the nose, it can go backwards to the back of the nose and then fall into the throat or the windpipe. And that's a potentially serious problem. That being said, that's typically not real likely. And it would take a lot of finagling and wiggling for that, whatever it is, a bead or a rock or whatever, to get all the way back there. But it is a possibility. So when something's stuck in the nose, it's not something we want to wait around on and schedule the patient to have it removed the next week or something like that. It is something that probably needs to come out the same day or within 24 hours. The plus side is that it's a lot easier to get things out of the nose than to get things out of the ear. So if you watch my video on foreign bodies in the ear, especially in kids, you probably learned that we usually need to take them under anesthesia to get it out, just because it's almost impossible with an uncooperative child to get into the ear safely and get a bead or a rock or something out. With the nose, the anatomy of the nose is helpful. So the most narrow part is right at the nostril, and then the nasal cavity opens up on the inside. So if anything is small enough to fit through the nostril into the inside of the nose, there's always going to be a lot of room around it on the inside of the nose. So for that reason, it's a lot easier for me to get an instrument in there that can grasp whatever it is, whether it's a rock or I think I've seen like an action figure's head or, who knows, a bead or whatever it is. It's much easier for me to get in there, grasp it with an instrument and just pull it out. Another nice thing is that for a child who's not wanting to be cooperative with this, it's actually a lot easier for the parents to restrain the child and for me to safely get in there, just because there's more room to work in the nose than there is in the ear. So in my experience, for foreign bodies inside of the nose, I'm almost always able to get them out in the office. Which is nice because it saves, a trip to the operating room, another day off of work for the parents, risk of anesthesia, all of that. We don't have to worry about so much with nasal foreign bodies. So, if you or your child or someone sticks anything in their nose, I can get it out. So come and see me. So I hope everybody has a good day, and I hope you're not having to deal with this. But if you are, we're here for you. Have a nice day. I'll talk